Dear friends, I am happy to see you once again this Saturday, 18th January 2025. We have finished 1,515 cases of Puberphonia. So, thereby, we are going for a next order of treatment. See, we are so happy to inform you that we will be in uh, a live channel on 22nd Wednesday from 8 p.m. onwards. You can contact me. I will broadcast the Puberphonia, what we have done. The 1,515 cases will be reviewed, and this is supported by Agenda Pharmacy, Agenda Pharmaceuticals. They are very interested in helping me to go for a channel meeting on. So this is really a great occasion. I will be able to give you a demo. So happily, I will give you a review of how we have treated 1,515 cases on Wednesday 22nd, 8 p.m. So it will be broadcasted throughout the world. So you can have a chat with me, and I will able to share you what is the link we are going to give, because the link will come through the Agenda Pharmaceuticals of New Delhi. So this is the small information. Now we are going for little more extending our research on Puberphonia. What we are going to do is we are going to do flexible endoscope evaluation of speech recognition. So we got a new equipment, a flexible endoscope with a service channel. So service channel means usually it is kept for going to record what happened if voice is produced. So it is usually a flexible nasal endoscope. It is a procedure that uses the flexible tube to examine the probe with the pharynx with the uvula or larynx with vocal cord. So many experiment and detections and inference were already obtained on vocal cord. But what happened to the uvula when we speak? It is not so much the work is done, because we are the people, we insist that uvula is a speech organ. Even though it is recognized for a long time, now it is our duty to prove the uvular structures. So very interesting for me. So this flexible nasoendoscopy, we use a camera which is a thin, flexible, in a flexible tube, and it will be passed through the nose so that a clear view of the throat and voice box can be obtained. That's all. So there are two objects for me to use this, because it is purely Very interesting for me. That's all. We are going the next step. The first object is a high-speed video endoscopy. It became a robust tool for the assessment of the uvula vibration in lab investigation and clinical practice. So we are going to describe the first successful application of flexible high-speed video endoscopy with the innovative laser light source conducted in clinical settings. We are going to demonstrate the high-speed video endoscopy recording of the fiber optic flexible scope, which have enabled obtain consistently bright color images suitable for uh, a calculation of uvula oscillation. The period and amplitude of protuberance of parameters calculated on the basis of the image and audio data occurred from the flexible high-speed video endoscopy. And we will confirm it, what is happening, what is the best suitable method for examination of the natural phonation. This high-speed video endoscopy, based on measuring generated from the kymograph analysis, are arguable for superior representation of the uvula vibration than the acoustic analysis because of the qualification is independent of the vocal tract influences. This experimental study has several implications for further research in the field of high-speed video endoscopy application in clinical assessment of puberphonia nature and effect on uvula vibration. So this is the first object. The second object of our research is to find out a small device to do uvula manipulation. We are treating puberphonia by not doing the conventional method. We ENT surgeons are familiar with a lot of surgery in relation to the uvula while doing surgery for snoring and cleft palate. Now, our object is a small work loading manipulation of the uvula. So, if we are able to find a small instrument for loading uvula, then we'll be successful. So we are on the way of finding an instrument to load the uvula. So if we find the instrument which can increase the load of the uvula, then it can be used by ENT surgeons, speech therapists, occupational therapists, physiotherapists, and all other people who are interested in voice care. That's all. So a high specialized voice disorder, I personally feel puberphonia, it needs laryngeal also, pharyngeal also, vocal tract assessment via an endoscope. So what are the benefit? I am featuring our new video endoscope of the uvular movement. It is similar to finding out what happened on the vocal cord when we talk. We are having the feeling just like similar to vocal cord, uvula is also a speech organ. So we'll be able to tabulate what are the features happening in the uvula when we talk. in low pitch, even in high pitch, or in different pathology. So what are the things we are going to gain? We had a few experience, we are able to get a good idea. We are able to calculate, there are many benefits by our new procedure, video endoscopic, audio, video recognition of the movement of the uvula. So, what are the advantages? Number one, it helps us to identify and describe the phonatory structure and their function from the tip of the nose to the larynx, tip of the lips to the larynx. We are going to rewrite what are the movements happen, what are the sound, how it happens, what are the anatomical changes, the same manipulations. So what happens? What are the vibration? So this is the identify and describe the phonatory structures and their function. So we are going to introduce a flexible endoscope and we are going to measure. It will not only having video, it is having an audio probe also. Audio probe we have prepared. We will be able to assess the auditory energy, how it happened, each and every word. So that is the number one. Second one, identify the presence and assess the effect of lesion, structure of abnormality or alteration in the function of the phonation and speech. So this with audio video mean it is a great advantage for us to go to the next level. What is the assess the effect of lesion? What are the structural abnormalities and alteration of the function of the on phonation and speech? Number three is assess the interpretation of the above part of the clinic for clinical discussion. So thereby it helps us in further diagnostic process. Number four, independently carry out the above within the boundaries and experience as outlined in the competency of framework. Fifth one is very great thing. We are able to provide feedback regarding the vocal tract function as a part of the therapeutic process. So we'll know what are the limitations, where we are standing. Number six is direct treatment and evaluation of effectiveness. So we'll be able to find out evaluate the effectiveness. So what is the value of our treatment? Number seven is we'll provide visual feedback during therapy. We'll be able to give the therapy because here comes artificial intelligence also. What is the visual feedback of the success? Immediately you will be able to tell. So the artificial intelligence comes here and it calculates and give you. I am going on telling first day itself 70% of the Puberphonia boys will get their ancestor voice. Is it recognized by the Puberphonia boy? Yes. artificial intelligence will tell they have recognized their own voice, which is there. See, here I want to tell you some important thing. Puberphonia means everybody knows the boy will have a child's voice or lady's voice. But there are 10 varieties already I have explained in great extent. Some people will have double voice. Some people with limited strength, they will be able to talk in low pitch. But in phone call, the culprit will come out and they will have high pitch voice. And few people, they won't have a strong voice also. The voice is not strong. That's all few people used to come and tell me. If you record, when they talk to me, when they had come for treatment, they will have low pitch voice. But phone call, they cannot cheat the public. They will have the Puberphonia voice. So they themselves will come and tell us, I want a strong voice. So the 8th point is improve patients' understanding of their voice disorder. So patient understanding of the voice disorder is very, very important, because the boys are coming on asking me, oh, my puberphonic, that's all. We have to prove you are having this voice by materialistic, by artificial intelligence. We should tell you are having puberphonia. If it is changed, what will happen? Then only they will come for treatment boldly. Because we are taking long time. Within 5 days, we are making it all right. So we will provide a visual feedback during therapy. We will improve patients' understanding of their voice. Number 9. Record monitory behavior and literature for further references. So everything are there fed in the endoscope and camera. It is stored in the computer, and then only it is calculated. So it is easy for us to go ahead. There's no question of avoiding the result or changing the result. Then and there, every word is counted and it is saved. So it is a great feedback they will get. So it improves the patient understanding of their voice disorder. Then record monitory behavior of laryngeal structure for further reference. The next one is very, very important. So whatever you say, we'll be able to help the patient. Yes, we are helping the patient, okay. But they should recognize the ancestor voice. They should have a auditory feedback. They should have a improved understanding. They should have a recorded their voice. They should be provided with endoscopic laryngeal visualization during laryngeal procedure, pharyngeal uvula manipulation procedures. Above all, it will be good for follow-up. So it is a great thing. We are going for the next step of flexible endoscopic visualization of the uvula. See, every day we are learning, thereby we will be able to provide a good treatment for this puberphonia. Then only we are aiming for a workshop and add-on courses for all colleges students. So it is a value-added education we want to give for the boys. Then everybody will recognize whether they are having puberphonia or not. So, a value-added course will be started very soon in all colleges, and they can record their own voice and yet assess whether they are having puberphonia voice, high pitch voice, low pitch voice, double voice, or not strong enough. So it will be given as a add-on course. So they will have a value on course, and future we will try to have a very good assessment of the voice because of the next step we are going for treatment is the great thing called as high speed video endoscopy to assess the vibration in a laboratory investigation and clinical practice. So this will be a great thing. We hope for the best. Next Saturday itself, we'll be able to give a good answer for the same. So thank you very much. Today is Saturday, 18th January 2025. We have finished 1,515 cases of puberphonia. That means it is a world record for everyone in the world. Happy. I will see you next Saturday, the same time, 5:30. Thank you. Great.